And
Welcome everyone, and I'll call this meeting to order. As the first item on the agenda is the approval of the agenda. Could I have a motion to that effect, please? Jacqueline and Melody, thank you. All those in favor? Opposed, if any? It's carried. Next item is the confirmation of minutes. Derek, I don't believe we have the minutes for the last meeting.
That's correct, Peter. As a special meeting, we don't typically have minutes from the previous meeting. So we'll have 2 sets at our regular meeting in September.
Okay, excellent. Then moving on to disclosure of pecuniary interest. Does anyone have a pecuniary interest involving the items that we're going to discuss today? Hearing none, move on. We don't have any delegations that I'm aware of. Derek, is that correct?
That is correct. There are no delegations.
And there are no briefings, so that moves us to the business portion of the meeting. And the reason for the meeting is a report that we have all seen from staff regarding housing and homelessness strategies and policy amendments. So I'm going to ask staff if they can give us a brief overview, and I'm wondering if perhaps we want to chunk this up a bit so that it seems to be divided into maybe 3-4 sections dealing with specific things. For instance, the first one being shelters. And perhaps that we could go through each section, and as we go through, and I'm unclear as to Ruth, are you going to be leading this, or I see CAO Hurdles with us. Good afternoon, Lanny. Whether between the two of you, you're going to be leading this, but is that a reasonable approach to dealing with this instead of sort of jumping all over the place, if you will? I see Lanny nodding her head, and I'm assuming Ruth is nodding her head also. So I'll pass this over to staff, and I'm not sure who's going to start here, either the director or the CAO, and I'm not. I'll let you two arm wrestle on that one.
So thank you, Mr. Chair. I'll get started and maybe provide the committee with a bit of an overview of the report and why this report is being brought forward to the committee now, considering that, you know, there was a meeting about a month ago, 3 weeks ago, and that there's going to be another one in September. So in light of some of obviously the challenges we're having around housing and homelessness, we felt that it was important to bring a report to the committee that provided an overview of the continuum, because often we have separate conversations about different projects. So there may be initiatives or projects related to shelters or affordable housing units at 80% market rent, but those tend to be quite separate and segregated. So we rarely have a chance to put the different pieces together and provide the committee with a large overview of the continuum and some of the initiatives that apply or that we're seeking support to move forward along the continuum. So that's why we wanted to bring the report. There's also a recommendation in the report in regards to some changes to a reserve fund to enable us to access more dollars for new affordable housing units. And that also is a bit time sensitive, considering some of the opportunities that may be coming forward for affordable housing units, and making sure that there is sufficient capital dollars to be able to move and support these types of acquisition. So I think what I'll do is I'll pass it over to Ruth to go through maybe each of the different sectors in more details, but I wanted to make sure the committee had an understanding as to why this was coming at this time, and what, as staff, we were trying to do to lay out really the different initiatives of along the continuum.
Thank you, Lenny. Through you, Mr. Chair, can everybody hear me? Okay,
Yep,
right.
we can hear you.
Thank you. So thanks to the committee for allowing us to kind of present this report, because as to CAO Hurdle's comments, I think it is really important to have that broader system kind of overview to kind of position some of the current conversations in the community. So the first kind of area of this report is really kind of focusing on the shelter services and kind of the services that we provide in our community to our most vulnerable. And what we've done is just try to summarize kind of what we have been seeing in the last little while, and kind of in our service, in our system. We've kind of explained what we've done, obviously, in response to the COVID-19 pandemic, but also we have summarized some of the steps that we would like to take moving forward. So as you know, we've taken steps to move our shelters to physically distanced locations in response to COVID, while they worked through kind of changing their locations, which obviously has, and we've kind of pointed that out, which obviously is impacting some of the shelter capacity. However, we also have been able to create an overflow to allow for any potential shelter beds that are needed, while we're kind of working through many of the changes as we speak, obviously including the integrated care hub that we are piloting and trying to obviously work through a more permanent location for that. So obviously happy to answer any questions on that specific area, but just to summarize, you know, what I think is really kind of a crucial step that we would like to take in the next few months is to work with our partners, with our clientele, and with obviously the community as a whole to really review our shelter or our homelessness system. And I think it was pointed out earlier, this, you know, we obviously have seen through this that, you know, we really need to look at what is working well in our system. And I think some pieces are working really well and have worked really well. For instance, our Housing First has been able to house many clients, but we also have learned a lot, not only over the last 6 months, but over the last few years, especially in dealing with a more vulnerable population. And we really think that this is a really good opportunity to learn from the last 6 months, to bring some of our partners together, to have conversations with our clients, and to review the system. And our hope is that that will result in basically a new request for proposal that we would like to have available in our community for kind of that service delivery moving forward. So that will be a big piece. Obviously, lots to unpack there. The other pieces obviously are regarding, you know, as I mentioned, the permanent location for the drop-in center that we're working on. We're also, as part of, I think, the bigger kind of review, are looking at our homelessness priority on our social housing waitlist. And we are, as I mentioned, continuing to use while we look at a longer term supportive housing for Lower Union to use that as overflow. So through you, Mr. Chair, I'm happy to speak to the other elements, but I can also kind of halt here and see if there are any specific questions or if there's anything to add through my colleagues as well.
Let's see if there are questions on this section. I'll start with Councillor Holland.
Thank you, Mr. Chair. Thanks, Ruth. One thought or question, I guess, that just comes up looking at the timeline of the recent past. When we think about what took place with the transition in the shelters when COVID first really struck here, and we needed to incorporate the flow or physical distancing situation, it appears as though there was at that moment some catalyst that brought about what we saw as campers started to congregate in various parts of the city and ended up at Bell Park. Was there any problem with introducing the new locations that we could consider it? The shelter review is going to be taking place in the context of COVID. So I'm just curious about how we're going to think about, will it include a review of what has taken place as far as what that transition brought about? And do you have any thoughts on what the COVID shelter service might look like, that maybe information that we're getting from the province or public health?
Through you, Mr. Chair. So how I think it is a combination. So obviously we have learned a lot over the last 6 months, and I think some of the issues that were already issues have become even more visible. I think what we need to, what we really would like to do is understand, based on our last 2 years of shelter use, but also kind of reviewing kind of some of the conversations around shelter access, shelter restrictions, and then pairing that up with also adding, I think, as we all have heard, the opportunity to bring, for instance, the healthcare partners into the system as well. So obviously learnings around infection prevention, capacity. I think it really, the review, we would like to combine both obviously the learnings from COVID, the geographical pieces, the encampments, and to be fair, like encampments have not been new, or are not, I think there's definitely been a spotlight on this, and I think it's really kind of come to a broader conversation, which I think is really truly important as a community to have, but it's not a new conversation. We've had street outreach and staff of various community agencies working with people that are living rough. I think what is really a great opportunity now is just to combine what we're learning from the last 6 months, and also what we have been learning over the last 4 or 5 years when we transitioned from one system to kind of more a housing first focus. And ultimately, obviously I cannot predict what the outcome will be, but I hope that the outcome will be a combination of, what worked well, what didn't work well, and some improvements and some new hopefully some new partners at the table as well, especially on the healthcare and social services side. And the last thing I will say about that is that I think we have an opportunity now with better data, with a by name list, which this committee has been presented earlier this year, pre-COVID, and also, implementing more of a client voice in the review. I think all of that combined makes me feel that we have a good opportunity to, to improve and learn.
Thank you.
Melody.
Ruth, I heard you mention reviewing homelessness as a qualifier to get expedited into social housing. Is that something that's within like the municipality's like mandate to do? It was always my understanding that was a provincial decision. Could you let me know whether or not the city has power over that decision?
So thank you, through you, Mr. Chair. I will kick that off, but I definitely would like to also request Mr. Grange to help with some of that. So obviously we have both provincial directives in how we, we're basically mandated, for instance, to have a certain number of units in the social housing sector. There are certain kind of rules that are specifically mandated provincially, but there are also local directives that we do have the ability to create. And again, across the board with the 47 service managers in the province, there's definitely some different kind of priorities that are being developed locally. At this point, our own, the only kind of local directives regarding priority is focused on individuals that have suffered domestic violence. But historically, we have, before I was in my position, but we have had a homelessness priority as well. But I would like to hand it over to Mr. Grange as well to maybe provide a little bit further context on that.
Thanks, Ruth, and thanks, Melody, for your question, and through you, Mr. Chair. Yes, to build on to Ruth's comments, under the Housing Services Act, we do have the ability as service manager of the City of Kingston to implement our own local policies. The only mandated policy through the legislation is for special priority, as Ruth had indicated. We did have a homeless priority in place leading up to 2014, at which time when our homeless services were revamped and the Housing First model was taken in. At that point, the homeless priority was taken off the wait list. The way it worked at that point was that each individual housing provider receives their own subsidiary list to the overall wait list. And they were to offer 1 in every 10 vacancies at their location to an individual who's experiencing homelessness. So we are open to revisiting that. We don't feel that just putting back in place what was there existing is the right method to do so. I think we want to take the time to do our research and make sure and consult with other service managers and community groups to make sure that if this is something that we proceed with, that it's done right. And in addition to that too, there are some changes coming. Recently, the Protecting Tenants and Strengthening Community Housing Act received royal assent, and part of that will be quite drastic changes coming through the Housing Services Act, which will allow us more flexibility to work on the centralized waiting list. I think that eventually we'll see that through the regulations as they get developed, that the wait list will move away from a chronological wait list and more to a needs-based approach, which will allow the municipalities flexibility to determine how best to implement that at a local level. So long-winded answer, but hopefully that addresses your question.
Peter, I believe Francesca has raised her hand.
Okay.
If we'd like to go to her.
Francesca, thank you, Derek.
Hi, I'm curious as to how the building on Lower Union will be renovated and who it will be aimed at as far as, will it be temporary housing or what's the plan?
Thank you for the question, and through you, Mr. Chair. So what we're, sorry, just to kind of go back to the question. So we've purchased the building, so the city is currently owning the building. we have a request for proposal that we have created that we would like to send out to our partners in the community to see what partner would be willing to operate this facility moving forward to specifically provide supportive housing services. We obviously did our 10-year housing plan update last year, and we've been looking at our by name list data to really understand kind of what the various potential priority groups could be. Obviously, we know we have a fairly high group of vulnerable women in our community that are homeless. We have families, we have an Indigenous community that we've identified as priorities. But obviously also over the last 6 months, we know that we've learned a lot from the Bell Park situation. So what we are as staff hoping to do is to get this request for proposal out as soon as we can. Obviously today is a good conversation, but to have proposals back kind of from our community partners. We're also hoping that we potentially have some partnerships of agencies, but we are definitely asking our partners based on some of the learnings and the information and the data that we have to see what they can provide. And I know we're kind of jumping to the next part of this report, but we are also obviously as a city and our partners, I think it has been adamant that supportive housing is really a big or an important gap in our community that we need to address. So in addition to obviously the Lower Union building, which would only have, or not only, but would have 19 beds, you know, looking at our numbers and the individuals that have been identified as you know, vulnerable, we would probably need to continue to look at other options if we can find them. And I think a really important piece here as well, and that's, you know, obviously our opportunity as staff and council to continue to advocate for kind of that relationship between housing, health, and mental health and social services. We, at the same time, we're also, obviously we have to also look at kind of the upgrades that are needed or the work that's needed to get the building operational. So we're working on that at the same time. But I know that's a very long-winded answer, but I hope that that's helpful.
Okay. Jacqueline.
Thank you. The numbers had gone down in shelters over this time. In some cases, pretty steep declines, and of course, due to COVID and possibly fears in that regard. I'm just wondering, do we have sort of an estimation of what we might see happen as the winter months come? Are we expecting, because I know they've continued, numbers in shelters have continued to sort of get lower. I'm wondering if that's what we're expecting going forward, or if we sort of are anticipating, you know, a spike in more clients visiting shelters over the winter months.
Thank you for the question, and through you, Mr. Chair. That is definitely a really good question, and to be able to, I think what we're trying to do is to right size the shelter system, but also be nimble enough to be able to have the opportunity to support an overflow in certain months of the year. I think, and I hope that became somewhat clear in the reports, but we want to make sure that we understand kind of what are the number of shelter beds that we would need on average, what are kind of the peaks in the year, but also, you know, obviously, if people are not accessing the shelter right now, why are they not accessing the shelter? Would they potentially be willing to access the shelter if we make any changes? Or maybe, you know, obviously also with adding this integrated care hub, maybe that is another kind of, we're hopeful and kind of really excited about that pilot and understanding if that would be another kind of piece to the full continuum as CAO Hurdle introduced. And so I mean, I don't have the perfect answer to be honest, but I think what we do want to make sure of is that we're not going to, let's say, cut down on shelter beds right now because we now don't have the need. Obviously, it needs to be a nimble approach. And it needs to, it's not a, again, I use this way too much over the last little while, but it's not a one size fits all. And it's not like, okay, it's not just a numbers game either. So what we're hoping is to have just a more of a variety of options and maybe some opportunity to have either overflow or the kind of the drop in over the, you know, the months that we need more beds. So we don't have the answer exactly, but we definitely want to also use the next 2 months or so to review and understand what would work best.
Melody.
Thank you. In your Ruth, in looking at the options in accommodating the complex population, is the city at all considering like micropods? A lot of people who are homeless do value their privacy and their independence. There's a lot of reasons why some people don't go into a home is because they just, or a shelter, excuse me, is because there's interpersonal conflict with somebody already in there. And I know myself, when I became homeless, I had a baby. I did not want to put myself in a situation where I was mixing with a population. Some of them had drug addictions. Some people had mental health issues. It was just a big unknown, and that just felt too unsafe. But I would have taken a pod in a heartbeat if I just had a private, insulated, heated room to go to sleep in, that I didn't have to mix with everybody else. I think that fits in really well with the psychology of a lot of people who are still holding out in tents and don't feel compatible with the shelter system. So I'm just wondering how hard the city's looking into expanding in that direction.
Thank you. That's an excellent question, and through you, Mr. Chair. So I will start, and perhaps also CEO Hurdle or Mr. Grange will have some things to add there as well. I think what we definitely have seen, not only because of COVID, but also just as a kind of a reality of how we support our vulnerable members of the community, is that a communal solution, or a solution, for instance, in a shelter with a communal sleeping arrangement, is something that ideal scenario, longer term, we would like to look at kind of more of individual rooms or individual solutions. So that's definitely kind of something that, and even on the national level, when we have, with our, for instance, the Canadian Alliance to End Homelessness, and there's been some really good research on kind of the need to really look at kind of moving away from communal arrangement towards more like individualized emergency housing type models. So I think that kind of would definitely, I think, address that notion of individuals. And again, we need to talk to clients, obviously, as well, to further understand that, to have their own space and kind of more private space. In addition to that, we are also, and I know it's not kind of exactly the same as what you're identifying in your question, but we're definitely also, as council has set the priority to look at tiny homes as an option. I know it's been addressed in this report as well. We are also working on a tiny homes project with our partners in the community. So the micropods suggestion that you are sharing, we have not specifically looked into that, but I will say that kind of that individualized, the need to really have a private individual space for clients is definitely something that we would like to move on moving forward.
Okay, are there any other questions? Seeing none, I have a couple. I guess that, and I'll address this to Ruth. I think that one of the concerns that I have when I looked at the report, I applaud. Let me start by saying that I applaud you looking at right sizing the or looking at the sizing of the shelter system. It's been in place for a number of years, and we now have some data that will enable us to have a better look at are we close to being at the right size. I guess my concern, I look at the timelines, and I'm a little concerned about the rush, or what appears to be the rush to move the shelters back to their original buildings. And I'll pick up on Jackie's comment that about what is the fall going to bring. And I think that my concern particularly revolves around the youth shelter, given that I'm making an assumption, but it's going to be a month or two before we do anything with that building. I'm wondering why we wouldn't just leave the youth shelter where it is, and if there is a need for additional capacity, it's built in, if you will. And I think that comes from the concern that one of the places I think we've been successful in Kingston in terms of youth homelessness is the practice that we've taken of not mixing youth and adult clients in homeless shelters, and I think that a lot of the reasons that Melody raised about concerns that she had, I think can be equally addressed to mixing young people and adults in a shelter situation. So I guess that's a concern that I would have, and if we come up with a number, and I have no idea what the numbers are, and I'll leave that to your good judgment, Ruth, you and staff. But if we do end up with problems in the fall, it would be a shame that we had gotten rid of capacity when we didn't need to.
Thank you for that question, and through you, that is a really good point, and that's exactly why we do want to be nimble and have lower union available for overflow. At this point, we still have, so lower union has 2 levels, and they're both separate. They have separate entrances, and at this point we have still the youth shelter in lower union on one of the levels, and we have the overflow at this point on one of the levels. Depending on how, again, the next couple of months will evolve. We still, obviously, we have the youth shelter building that we can utilize. We have In From the Cold, we have our drop-in. We also, we have obviously a family shelter that has also, that we have hotel options. So there are, I think we don't have obviously a crystal ball. We don't know exactly what the fall will look like, but we also, in addition to knowing that we have enough beds in the system right now, again, we may need to move some things around depending on how the next month will look like. We also have worked with public health in making sure that the shelters have the right kind of screening processes, have the right setup. And I think also, obviously, back in March, this all came when this all kind of started to ramp up. We we learned a lot through setting up some of the self-isolation pieces, but we are very lucky that, for instance, the testing turnaround time of individuals has increased quite significantly. So, like I said, we continue to have an overflow and enough beds and enough nimbleness, I guess, in the system to respond in the fall. But in addition, we also have now improved with our partners the practices of the shelters, the access or the kind of the screening and kind of the testing. Yeah, I think that kind of answers your question. And I think actually Mitchell has something to add to that as well.
Thanks, Ruth, and through you, Mr. Chair. Yeah, just to add, to build upon Ruth's response, and certainly to address the question of why now in terms of the shelter relocation. For 670 McLean Court, where the adult shelter was located, the owner of the building had other plans for the site beyond the end of July. So our lease was expired and wasn't able to be renewed. So that kind of sped up the transition back to 540 Montreal Street. And in doing so, certainly the capacity was reduced in dealing with the public health, the IPAC team, and understanding what capacity would be like and proper spacing of the individual beds within the center. And further to that, there's been individual IPAC teams dedicated to each shelter facility and are working through with their staff to identify how they may be able to allow for self-isolation within their space, what to do in the event of an outbreak. So Public Health Ontario, through our local health unit, have been able to provide those resources and documents. And Melody, to your point of ensuring that the shelters are, I believe it was your point, sorry, are separated with the youth shelters still on site at Lower Union. We do have that upper level, which will be utilized for overflow. And as we did have the self-isolation center mobilized there for a month or so, in order, when we set that up, we had to meet public health guidelines to ensure that both levels were separate and you couldn't access between floors for the individuals utilizing the space. So it is set up well to accommodate two different uses on site. Thanks.
Okay, thank you. I'm just wondering, before we move off from the shelter portion of the report, do Councillor Neal and or Councillor Hutchison have anything that they'd like to contribute or ask?
And for the councillors, if you do wish to speak, we'll just get you to go ahead and turn your video on, and that way we'll know you wish to speak. If not, we'll move on. So we'll just give it a few more seconds there, Peter. All right, I think we can move on.
Okay, so let's move on to the next section, and I'll give it back to Ruth.
Thank you so much. I know we already kind of started to dabble into the supportive housing component of this report, but as kind of already discussed, within our 10-year plan update and the conversations that we've also had at this table, we have certainly identified the need to as a community to add kind of more supportive housing options. Again, that's, you know, historically, or as a kind of a service manager, we typically get involved with developing affordable housing or social housing. Supportive housing is really a partnership quite often between different agencies, so that's definitely been kind of a big key kind of conversation that we've started at this committee as well. So what we've done, as mentioned, we have gone ahead and been able to purchase Lower Union, which, as I mentioned, we are working through kind of an RFP and getting that hopefully out in the community soon. The other piece, and just kind of reiterated this, we have been supporting a private sector development in partnership with Anguanada, which is obviously also one of our partners in the community that is providing supportive housing for individuals typically with developmental disabilities. And in addition to that, we also just wanted to point out that, and you probably have been seeing this as well in various news avenues, that home-based housing has been or is currently working on a project on 484 Albert Street, which is which will really focus on supportive housing for youth. And they are looking at relocating their kind of one roof youth kind of hub towards that location. We also wanted to point out that there's another project that home-based housing is working on, which is also kind of in the vicinity of kind of downtown, that is looking at a kind of a supportive transitional housing solution for individual adults. So what we obviously again in this report pointed out is that we want to continue and move forward on the Lower Union request for proposal, that we want to continue and I think as part of our better kind of by nameless data and understanding, we will probably continue to have a better sense of the actual numbers and kind of needs of supportive housing moving forward. We continue to look at these options and kind of see if there's other opportunities to acquire buildings and kind of do a same approach as we are envisioning with Lower Union and work with our partners. And then the last part, which I think is again quite crucial, is the supportive housing piece really does require, I would say, almost multi-level or provincial ministries, different partners in the community, different funding streams. So we really would like to kind of continue to put that on the radar of both different ministries, different partners. One of the things, and I know in the 2019 budget, Ontario provincial budgets, it was pointed out that that the ministries did recognize that supportive housing needed to be a cross ministerial coordinated efforts. So we're trying to have those conversations as well to really understand what our municipal role is and how we can work with our partners to make sure that we are a catalyst for some of those projects. Our understanding is, and again, due to COVID, the initial timeline for some of that supportive housing kind of collaboration was to start some conversations in 2020, early 2020, and we're kind of trying to work with the province to understand when this partnership and this new kind of collaboration will move forward. Anyway, that's a lot. I think that's kind of it for the supportive housing piece. Lots to work through still, but definitely a few projects that we're trying to move forward at this point.
Okay, questions? Melody.
Hi. Correct me if I'm slightly off topic, but I'm just curious about whether or not the city is discussing the situation like that a lot of families are in, still living on CERB, with a lot of people not back to work yet, but also the exorbitant like rental prices in Kingston. The two don't match each other. So for somebody like, I'm wondering how we're going to keep Kingstonians in Kingston if they have to move right now. I've been looking at housing, and they want like 70% of a CERB check just to get like a 1-bedroom apartment. And so there's a lot of people still relying on that government support. A lot of parents who can't even go to work because summer camps got canceled. So I'm wondering if there's any support being considered for this group of people?
Thank you for that question. That is, you know, definitely a big, a big kind of systemic question, I think, too, but absolutely impacting our community and the whole country, I think. I definitely will try to kind of take a stab at it. I think as we kind of went through our 10-year housing and homelessness plan updates, you probably all recall that we identified that as a community, we have many families that we consider to be in core housing needs, which basically means that people are paying more than 30% and quite often more like 50 or to your point, 70% of their income monthly towards their rent. We also know, not something, well, we've obviously addressed that both at this committee, but also at other tables, that our average or that our market rents or average market rents is quite high in our community. So obviously that is something that we see. I think what we are obviously within actually my department, Housing and Social Services, we have ways to support people depending on obviously, you know, various kind of, it's not, again, not a one size fits all, but we do, for instance, have an opportunity for those people that do get into rent arrears to support them with discretionary benefits, people that are not on an OW or ODSP income and do have issues with their rent or utilities. There's ways to support them as well through other programs that we work with partners on. But it's definitely, I mean, the conversation with CERB and obviously the amount of money that people receive on social assistance, it's definitely, again, showing some bigger issues. We are trying to understand, like, obviously when CERB, and if CERB is not available anymore, how we then can prepare for some of those potential situations where people are getting in rent arrears. I believe this was raised at a previous meeting. Obviously, we have a fairly good understanding of what the market looks like for those that are, for instance, in social housing or in affordable housing, because we have those direct relationships. I definitely think it's important to also keep an eye on kind of those that are currently in market housing and the potential with the relationship with the landlords to understand how many people are currently potentially in arrears and how we can support those. So sorry, that's a very long-winded response to the fact that we're aware of it and that we need to continue to really understand moving forward what the gaps are and how we can support people once they move back to their regular OW checks. So I probably have more questions on that.
Melanie.
Yeah, just to follow up, I would just let you know that I think that for people who already have a place to live and they'd like to stay put, that's good to know that there are some programs out there to assist with arrears. Unfortunately, for anybody looking for an apartment right now, they're not gonna get one. Landlords are asking upfront for proof of employment. I know it's not legal to discriminate, but people pick and choose who they want to do business with, and parents aren't getting chosen for housing, not below an income threshold. They're not getting chosen, and the conversation always dies every time I bring up my son. I get ghosted in conversations. People bring up income, and if I mention that I'm on EI, which I am right now, people disappear from the conversation. So people who need to find housing right now aren't going to be able to get into it. Is there anything in the works for alleviating that situation?
Thanks for that, and thanks for clarifying that piece as well. I mean, I think ultimately, and I know this is not the answer that you're probably looking for, but ultimately I do think it's about having enough housing available and having the right kind of demand and supply, and having the kind of the right healthy vacancy rates that hopefully will alleviate some of that in a longer term. I think, and I will kind of rely on Mr. Grange here as well, but there's definitely, as you pointed out, I think some things might be not legal. And I think there definitely are some ways of supporting people if they feel like they are being discriminated. But I think the reality is that that is maybe not necessarily something that we can unfortunately change like right now. But I do think we need to continue to bring that up. We need to continue to see what avenues we potentially can take to support people. Just kind of looking at Mr. Grange and see if he has anything to chime in. I know it's a very challenging situation, and I wish we could just change that on the spot, but I think it is definitely a hard one to solve in this moment.
Yeah, thanks, Ruth, and through you, Mr. Chair. I would say, just following our discussions as a group here last month, we certainly took those comments away and have engaged with our city's legal department to just do some further research into the legalities around what landlords may and may not be able to do in terms of offers of rent. We can certainly follow up on that, and there was direction to continue the open and the dialogue existing with our the community legal clinic, to hear their thoughts. And certainly, earlier in the call, I did bring up the Protecting Tenants and Strengthening Community Housing Act. There are some changes coming through the Residential Tenancies Act, which are certainly making a lot of news headlines and a lot of challenges people may foresee from the advocacy side of the tenancy piece. Certainly, until those regulations get worked out and put in place, as Ruth has indicated, it's quite a large kind of system issue, which is hard to pinpoint and give you a clear response now, but we're certainly aware of it and are trying to come to some solutions for the community.
I think that there's an enforcement issue of current rights. I don't see it happening. I don't see any enforcement of current tenant rights. Just in terms of discrimination.
Okay, and maybe I can ask Mitchell to pick up that comment, not necessarily needing looking for an answer, because I'm not sure there is one right now, but to put that in the whole folder of this issue that clearly you haven't let drop since we brought up similar issues last time. So I think those are good things that maybe the city can help find a solution to. I see Mitchell is unmuted, so I'll ask you if you have a comment.
Thank you. I guess just to close that out is, we know that the Landlord Tenant Board is still on hold and has been for some time. So enforcement of evictions and we're kind of still in a stall. So seeing how that kind of transitions back into to legislation and policies, and then things start to revamp. I know there's a backlog of potential arrears that are going to be coming in evictions, but it'll certainly be coming to light, and hopefully there's clear direction from the province as part of that. But definitely taken and appreciate the comment, and as we're able to provide updates or provide any sort of comments to committee or working group or the province, or however we can be involved in the discussions, we will certainly do so.
Okay, great. Thank you. Councillor Holland, I see your hand up.
Mr. Chair, just picking up on one of the points Melody raised, during our discussions on the Mayor's Task Force, we we had this moment where we thought, wow, you know, when someday we'll have all this affordable housing available, and how will we ensure that we have the right process in place, similar to the RGI unit wait list that we currently have. So I'm curious. I know that that staff mentioned that there's a gap there currently, and what we're going to be doing, how that will be introduced in the future.
Sorry, through you, Mr. Chair, can I just clarify your question, Councillor Hollins?
Yeah, so I actually have two questions, but the first one is, so we're talking a lot in this report about supportive housing, and I guess so two different components to this. There's affordable housing, and then there's affordable housing that is yet to be built. And then there's some of the supportive housing partnerships that we are more advanced working on. Thinking about the supportive housing units when they come available, is the intake process then through the organization, the partner organization, let's say it's Anguinata or whatever, I would assume that they would manage the intake process and the supports there. What about any other projects that are considered affordable housing projects that the city is a part of? How do we manage the demand or a possible wait list for affordable units?
Oh, I'm unmuted. Thank you. Thanks for clarifying that. So for the supportive housing and how the wait list or potential wait list would be managed, again, I would also definitely rely on Mitch on responding to some of this, but that would also really depend ultimately on who would be the proponents that is going to manage that. So it could, for instance, be somebody that is, it could be a part of like a social housing provider, or it could be, for instance, on like our partners at Anguinata or community living that have their own individual wait lists. One thing that we do know, and Mitchell just alluded to that as well, with the new kind of regulation that's coming out, is that there will be a push towards more of a, not just a social housing wait list, but more like a housing wait list that would not only specifically focus on those individuals that are looking for the 2003 social housing units, but would also potentially, because of their income, would, for instance, specifically be looking at an affordable housing unit, or would be looking at a social supportive housing unit. So I think it's a multitude of kind of types of units that people might be looking for. And we definitely recognize also, again, looking at our system, that we have a very scattered kind of approach, where we have agencies that have their own wait lists, individuals might be on multiple wait lists. So I know that's again not going to solve your question in the next few months, but I think in the longer term, what will happen is, and I think that will make the navigation for individuals in our community much easier to, we would have a one-stop shop for people to basically say, I'm looking for housing. So I'm just going to pause here and see if Mitch has anything to add.
Thanks, Ruth. Through you, Mr. Chair. Yeah, certainly under the current model we have with our housing providers who are funded through us currently, if they were to develop any new sort of affordable supportive housing, or even through their existing supportive housing as a system navigator, as a service manager, we are responsible for maintaining the supportive housing waitlist, but have delegated that to our currently funded providers. So if vacancies occur in existing stock, they would pull from their existing wait list and then run those applicants through our centralized wait list and our registry at the city to ensure they meet eligibility criteria. And if someone were, if an agency were to sign on and have a funding component for new affordable housing, they would be required to meet certain criteria for the rent up of that unit, meet certain income thresholds and rental criteria for individuals accessing those units. But yes, to Ruth's point, and as indicated earlier in the call, We do hope that as part of these changes coming through the HSA that we can really have that one kind of stop shop to our office or however that may look to address all community housing inclusive of social and affordable and base it on needs. So that's really where we want to go. We're just under the current legislation, we aren't able to get there at this point.
Councillor Holland.
Thank you very much. I just have one other question. And I know that, again, this is more longer term. And when we look at, when we do the shelter review, it might be a part of that, but I'm curious about the combination of things happening. So we have the future supportive housing partnerships that we're going to continue to encourage and organizations that are part of that. We have the integrated hub that we're hoping will be, that we do want to see continue on in a permanent fashion. And then of course, these organizations have their own work. So I'm curious about at this stage, whether or not staff can speak to the capacity of the partner organizations that would be involved and whether we will be able to continue to provide all of the different types of services in the various contexts that they currently and operate in and in the future. I know it's a hypothetical, but it seems to be something to be considering at this stage.
Thank you for the question and through you, Mr. Chair. No, I think that's an excellent comment. And I think what we are seeing, especially over the last 6 months, that we're seeing some really exciting new partnerships that are being created. For instance, as to your point, having our HIV/AIDS regional services and our Kingston Community Health Center step up to work through the integrated hub and with all the amazing partners such as Home-Based Housing and AMHS. I also think we are really, as I mentioned, kind of looking at opportunities to work with kind of the healthcare and social services sector. So, I mean, I cannot obviously speak to all the specific capacity of each individual organization, but I do know that there's definitely an appetite to continue this conversation around the vulnerable sector. As an example, there is a group of healthcare professionals that is now starting to meet to specifically identify. And I know this might not specifically speak to your question, but I do think it's helping the bigger picture. But this group of providers is really kind of addressing kind of, okay, where are the gaps from a primary care, for instance, perspective. Also, I know we do have other providers that we're currently not funding as a system manager that might be interested in having obviously we would like them to be part of our review, and we would like to understand kind of what their capacity is now and what their vision is moving forward. So long-winded answer, I obviously cannot speak for each individual agency and their capacity, but I do certainly think that as much as the last 6 months has been quite, challenging and is really highlighting some of the issues in our community. And I will say to you that that's not unique to Kingston. It's something that we see in every community right now. I think the silver lining definitely is that we have new partners and new conversations and new agencies that are participating in the conversation. And I think to build on that and having the, from a shelter side, from a housing side, from a support side, to really have that opportunity to take some time to have some strategic thinking and redefine some pieces, and also keep the things that are working well, because I also want to make sure people know that some things are really working really well and have been quite successful. That I think would be the perfect long-term solution, but it will take a while to get there. And I think it's important that people recognize that we cannot just change a more systems issue overnight. I'll stop talking now.
Thanks. Any other questions?
Mr. Chair, I believe Francesca has her hand up and she's now unmuted.
Okay, Francesca.
Thanks. Thank you. Thanks, Mr. Chair. Ruth, a little while ago you mentioned that vacancies would open up as far as affordable and geared to income housing. In concrete terms, how long would we be looking at? 2 years, 5 years?
Thank you for the question. And just to clarify, so your question is how many new vacancies we are anticipating, or how many new buildings we are anticipating in the social and affordable housing sector?
Well, I think a combination of both. And I know with the new buildings, a certain number of units need to be, included in that category. So yeah, just with the number of new buildings, what does the future look like?
Great, thank you. Thanks for that clarification. So I think, again, that kind of goes back to, there's a couple of different elements that I think will kind of are important in answering that question. So not only, I think we have on the kind of social housing side, we have a set number that we currently are mandated to provide through the province. I think a conversation that we're having in the social housing sector is not only how many units do we have, but also how long does it take for people to be able to access those units, and are we able to also move people along? Well, when they are in social housing, ideal scenario, we would like them to be able to, if they are, with supports, able to move into either affordable or market housing solution. Currently, we have. So I think it's not, that's just on the social housing side, it's how do we support the people that are currently waiting for housing on the social housing wait list. And we are working with our team on understanding kind of who's on the wait list, what are the needs, and what can we do now while people are waiting for social housing, because they're still housed somewhere. And we would like to make sure that we can support them with referrals, connections, and pieces to make sure that they know what they can access right now. So that's maybe not so much speaking to numbers of new units, but it's just making sure that we manage the wait list, the people, support the people on the wait list, and support people while they're in social housing. So they either are obviously able to be in that housing unit, but also potentially have the opportunity to move on. Also, I should mention that we obviously are working on kind of continuing to keep that housing stock sustainable from a kind of building perspective. And there's lots kind of happening on the provincial level as well to kind of work through some of that with mortgages coming to an end, etc. On the affordable housing side, and in the report it's been pointed out, we continue to try to, we try to continuously have affordable housing projects in the pipeline. We're currently, obviously working with Kingston Frontenac Housing Corporation on finishing up 27 Nights, which is a 40-unit building with mixed housing. And as pointed out in the report, we're also working on with 3 not-for-profit proponents on the 1316 Princess Street project, and we have just received some proposals from the proponents, and we're working through that over the next while, and hope to bring something forward to council as well on that. So it's hard to really put a number. I mean, obviously we have numbers in mind that we would like to see in all these different projects. But ultimately, I think it really is as a community, and it's not just the city, it's also our development community, our not-for-profit community. I think it's trying to continue to build new housing across the continuum, so everybody, depending on their income, will be able to find the appropriate housing units that will be a better kind of I guess balance between the supply and demand in our community.
Okay, Rob.
Hi. In terms, I guess this question is through you, Mr. Chair, to the staff, namely perhaps Ruth. In terms of supportive housing for the individuals on the wait list, are those individuals identified, or may they self-identify as Indigenous? And is there Indigenous services that are identified for those individuals for support as well, along with you know, the other partnerships that you had mentioned and the ways of support that you're doing so well? Thank you.
Through you, Mr. Chair, that's an excellent question. I will defer as well to Mitchell on that. But as you probably recall, we definitely have, I think a couple of things here are important to mention. First of all, we have identified the kind of the needs to, as to your point, to enhance our Indigenous support services in our system, and recognize that quite a high number of people self-identify as Indigenous in either our shelter system or beyond. So we have, as staff and as our priority this year, we identified to increase training and in our departments. Obviously, due to COVID, we have not been able to do that yet, but it's definitely on our radar. But as part of our, I guess, system moving forward and in the review, I would also really like to make sure that we include the Indigenous piece in our shelter system, and really have the services available to clients and access that. As for the supportive housing piece, and kind of the, sorry, let me backtrack one sec. As for the waitlist, the social housing waitlist, I would need to defer to Mitchell, because I am not sure if we are currently actually asking people a question about their self-identification. But again, in our working through our wait list and working through supporting people that are currently in social housing, I would also really like to have a conversation around like understanding who the individuals are and what their needs are. And I think part of that would definitely include, you know, understanding their heritage. So I would like to defer to Mr. Grange as well to chime in on this.
Thanks, Ruth, and thanks, Robert, for the question, and through you, Mr. Chair. I think certainly my thoughts were, when the question was raised, Ruth has done a great job in addressing those. What I can speak to, though, currently there isn't an identifier on our social housing wait list. But recently we did engage in a partnership with Queen's University and a PhD initiative to run a survey of individuals on the wait list, at which point that identifying question was part of the survey. So we have received back some data on that, and certainly we'll take our time and make sure we give a thorough review. And the hope when we put that in place was to, as Ruth had indicated, to help address the needs and find some support for those individuals currently waiting on the centralized waiting list. But also to guide our policies and procedures moving forward. And we have been waiting for kind of that the word from the province and the changes to the legislation to be able to focus again on the needs-based approach on the wait list and appropriately house people to the appropriate agency or supports that they need. So at this point, there isn't a great deal that we can add to your question, but certainly that we're aware of it and we've identified it as part of our 5-year plan. And recently have concluded that report through the PhD initiative at Queen's, and hope to take all that information and build strong policies and support moving forward.
Thanks, Mitchell. Are there any other questions on this section? Seeing no hands up, just a comment from my point of view. Ruth, I applaud, and Lanny, I applaud council for advocating for the resources. We shouldn't forget that this is an area that was downloaded a few years ago, and we're literally picking up the pieces. I guess my question, Ruth, would be that advocating for resources from upper levels of government and getting them tend to be two different things. And I'm wondering if as we're going through looking at the planning for supportive housing, or I'm hoping that we're also looking at what we can do with our own resources. And that's coming from the point that I think that the city has done quite well with housing first. The unfortunate thing is that the easy work is done, and in a lot of cases we're left with the more challenging folks that we need to house, and that tends to be where supportive housing comes in. So as I say, hopefully this isn't all dependent on upper levels of government.
Thank you, and thank you for that comment, and through you. We certainly cannot rely on that. I think we just have to, and I think part of the process that we would be implementing is also to, and that's always been our intent when we purchased Lower Union as a city, that we would, that the requirement would be for the proponents to be able to manage or to be able to find the operating costs moving forward. And we as a city would be looking at supporting with kind of the initial setup. So that's definitely an important point. And we know that each of our, depending on the service or the proponents, they have different either provincial or federal funding streams that they're using to manage their own operations. I will, but I think it's definitely, we shouldn't wait for or only kind of rely on that advocacy piece. But our intent always has been to work with our proponents, and the expectation would be that they would operate, that we would not as a city be part of the ongoing operating costs.
Okay, thank you. Rob.
I just wanted to add on to your comment, Mr. Chair. Definitely the most challenging, for sure. And I like the approach that the City of Kingston is doing in terms of educating themselves and informing the staff in particular, and changing the ways that sorry, I give you a close-up, you didn't want that. Changing the ways that they do business on a day-to-day. That's the very first step towards the continuum of, towards accessing the continuum of inclusion. Again, I thank you, Ruth, for your comments and your answer to my question. There's only so much that you can do at the very beginning until it takes off later on. Thank you.
Okay, before we move on, I've seen Councillor Hutchison square light up and the CAO square light up. Do either one of you have something you want to comment or question you want to ask in this section?
I'm seeing that CAO Hurdle has raised her hand, and then Councillor Hutchison as well. So I'll let you direct the traffic there, Mr. Chair.
I'll go to Councillor Hutchison first.
Thank you. I guess I'm here just as here we go. Just one sec. Okay, I'm here because this comes to Art next, and I wanted to get a preview. There are some aspects of this report that I find kind of disturbing. But I'll save that for ARC. And I want to check on some background material first. So, you know, I really haven't got anything much to say at the moment. So I'm fine. And I'm going to have to leave soon anyway. So thanks very much.
Thank you. Lanny.
Thank you, Mr. Chair. So maybe just to, I think Ruth did a really good job in answering the question in regards to the supportive housing component. And I just want to reassure the committee that when we looked at the model for 113 Lower Union, we made sure that if there was a shelter allowance allocated to the units at 113 Lower Union, that this model could financially work for an organization to operate. Having said that, we recognize that there are a number of different services that may need to be brought into the facility to better support people that are living there. So addictions, mental health, for example, may not be on-site present at all times, but could definitely be working in a partnership to have some presence within the building and be able to provide some support services.
Okay, thank you. Okay, can we move on to the affordable housing part, which is, I guess, the last one. And again, Ruth, I'll give it to you.
Well, thank you. And I think the committee is doing a great job to kind of already address some of the issues in this section. So as I mentioned already, and in the conversation, it already was pointed out, we are, as part of our departments, continuing to work on the development of affordable housing projects. Those projects quite often take a while to kind of come to fruition. So we try to kind of have projects, kind of stacked in a pipeline. And the next, the one big project, obviously, that we're currently working on is, as I mentioned, the 1316 Princess Street property, which is also a significant council priority. So as we've mentioned, we are reviewing the proposals that we've reviewed, and we will be in conversation with the proponents that have put in proposals, and are hoping to be able to report back to council in the fall. The other piece, and that's kind of more on the development related fees, we already have implemented as a city the measure that all the planning related fees are waived for affordable rental units that are 80% 80% AMR, average market rents, which, I mean, that was implemented 2019, but we thought it was important to kind of just put that out in the report as well. The other piece is that we are also looking at kind of the payment of the development charges over the construction periods, instead of like paying the full payments at time of the building permit issuance. So again, we just wanted to highlight that, and with kind of the mayor's task force last year, and kind of just a general kind of conversation around how we can make it, how we can remove potential issues with affordable housing development. These pieces were pointed out. And I think the last piece, obviously, again, as we've already mentioned, is that we are looking at, second last, I should say, is a tiny home pilot. So we're working with partners to look at some options and hope to bring something back to council as well. And the last piece, and although it's not specifically the scope of this committee, I do think it's worth mentioning that we are looking at other kind of initiatives that are helping to kind of maintain or increase the supply of affordable housing. And my colleagues at the Planning and Building and Licensing departments are, for instance, working reports towards administrative policies that would look at, for instance, a demolition control bylaw, which is an important one as well, looking at, you know, if there's a building that if we get a demolition or if we're looking at demolitioning a building, it's also important to look at what's the current number of units and what's kind of the future purpose of that building. So, and obviously a very big one is the official plan. And, you know, we want to continue kind of the conversation that we've started at this committee and at the Housing Task Force to kind of look at, if we're looking at official plan updates, that we also look at strategies and policies to further increase the supply of affordable housing. And again, I know those are all very kind of big, high level topics, but we just wanted to highlight to this committee that we really, you know, need to look at housing across the spectrum, and that although, you know, the developments of market housing and affordable housing will not necessarily, especially when we're looking at the 80% AMR, are definitely not necessarily supporting people on a very low income, but it might help to allow for some people that are currently in housing that's maybe more suitable for lower income to move into affordable housing. And it's ultimately all kind of really that full continuum and making sure that we have enough of each kind of type of housing for each kind of income category and kind of needs or a priority group in our community. Yeah, I think that's all I had to say about this section, Mr. Chair.
Okay, questions? I don't see any. Okay, then I guess we move on to
Mr. Chair, sorry,
yes.
there were a couple hands up there. Robert has his up and Melody had hers up.
Sorry, thank you. So we'll start with.
Sorry, I snuck mine in a little late. Sorry about that.
Okay, Mel, you go.
A question about this tiny house pilot. Ruth, what is the hoped timeline for that project?
I will start, and I might ask CEO Hurdle to add to this as well. So we are at this point in conversation with a potential partner that's interested in working with us on a project on a city-owned kind of property. But I am going to be very transparent. I don't have a very good overview of kind of the timelines that we're currently projecting. So I will hand that over to CEO Hurdle to address.
Thank you, and through Mr. Chair. So before COVID hit, we had actually started to make, I think, some pretty good progress with a potential partner that was going to look at building some tiny homes. And I do want to state that it is a not-for-profit partner, because I know there have been some anxiety expressed over potentially some of the private sector interest. So this one is a non-for-profit that was and I believe still is interested. When COVID happened, things kind of went on hold, to be completely frank. I am hopeful by this winter, sometime this winter, we'll be able to present a proposal to committee and council to be able to move ahead with this tiny homes project. And like Ruth indicated, it is going to be proposed on a city property.
Okay. Rob.
Hi. One quick question through you, probably to Ruth again. We were talking about affordable housing and supporting individuals. If an individual is identified to be eligible for, let's say, an Ontario Works or an ODSP, would the city entertain the idea of also giving them a portable housing fund to top up their, let's call it a financial availability to get into an affordable housing unit?
Thank you for the question. And if I understand you correctly, are you referring to basically if somebody is on the social housing wait list and might be eligible for a unit and obviously is on an income support, is your question, can that individual access affordable housing benefit instead of an actual bricks and mortar units? Or, sorry, I just want to understand your question.
Yeah, I think I'm still on off mute.
Yes, you are.
Okay, thank you. An individual, say, that was on assistance, let's call OW perhaps, and they're on the waiting list for a RGI unit or a subsidized unit through the city. They have a specific amount of funds. They are ineligible to access affordable housing because the market prices are so high. Would the city entertain the idea of giving a portable subsidy to that particular individual to top up the amount of money that they're getting from OW or ODSP in order to get them into an affordable housing unit?
So thank you. Thanks for clarifying that. So if I understand your question correct, and I am definitely going to also look at Mr. Grange to correct me if I'm wrong, but if somebody's on the social housing wait list and they do qualify for social housing and they would be, let's say, on top of the list, and obviously by introducing our portable housing benefit as an option in addition to actual bricks and mortar, they would potentially be able to access a portable housing benefit to then access an affordable housing or even a market housing unit. So I think then the question would be yes. But I am going to, I know Mitchell has his hand up as well, so I'm going to also make sure that I am not saying anything out of line.
Thanks, Ruth, and thanks, Rob, for the question, and through you, Mr. Chair. No, Ruth, you're spot on. We do have a local portable housing benefit available, which is the way it was established. I guess the nature of what portable housing benefit is yes, it's a housing allowance or housing subsidy that follows the individual wherever they choose to find or secure housing. And it is based on a structured rent calculation, which is legislated again, of course, under the Housing Services Act. But it really does do that. It fills that gap. That's exactly essentially it. It's the max shelter allowance and the actual rent itself, or the average market rent for the occupancy standards that individual is eligible for, and the portable housing benefit amount would fill that gap. Yes, they are. The way we have it currently set up is we have our. It's new for this year, but we reached out to all existing applicants on the social housing waitlist and allowed them the opportunity to remain on the list for a portable housing benefit. And now going forward, it's part of our application. So there is a wait list that's beginning to generate for it. In terms of wait time, it's so new. I can't give you an estimated time of how long that would take. But really, it is available now. And there also is a provincial portable housing benefit that we're administering in partnership with the Ministry of Finance and the Ministry of Municipal Affairs and Housing, which is called the Canada-Ontario Housing Benefit. It follows kind of the same model, but we are able to pull names from the wait list from the top of the wait list to offer those. And we have started offering the Canada-Ontario Housing Benefit as of April of this year, and we have been able to assist 60 individuals on the waitlist. So if they do have supports in place with themselves, if they're connected to supports, obviously those would transition with them to wherever they find suitable housing.
Great, thank you very much.
Okay, Derek, can you, I need some advice here. Before we go to the recommendation, is this where we invite public comment?
That is correct. So we do have one member of the public in attendance. So if they do wish to speak and they have the ability to ask questions or make comments based on the report, if they wish to do so, I'd ask them to use the raise hand function in Zoom. A reminder that can be found by going to the bottom, clicking on the participants button, and that will open up a screen on your right-hand side that lists the names of people on today's call. You then click the raise hand button at the very bottom. You'll be given up to 5 minutes, and if you have questions, sort of just say all your questions at once and then staff will respond. So I'm not currently seeing any hands raised, Mr. Chair. We'll maybe just give another few seconds if anybody wishes to speak. But I'm not seeing anything, Mr. Chair, so I will go ahead and turn it back to you.
Okay, leave us then proceed as if we know what we're doing here. I guess the next part of this is the recommendation, which has basically 3 parts to it. Although I'm thinking that we could probably deal with it as one motion, and unless there are members of the committee who would prefer to do otherwise. And just to paraphrase it, the motion would be a recommendation from this committee to the Arts, Recreation, and Community Policies Committee that basically endorsing the strategies and policy changes in the report. The second part is a specific bylaw change in terms of the Capital Reserve Fund, and that that the whole report be submitted to City Council. So if we can deal with that as one motion, I'd entertain a mover and a seconder. Councillor Holland. Jackie seconds it. Is there any discussion? All those in favor? Opposed, if any? It is carried.
And Mr. Chair, just since this is a fairly important report, since Francesca's on the phone, I'll just unmute her and ask if she's voting in favor or against. Francesca?
Yes, in favor.
Thank you.
Okay, thank you. Okay, moving on. I don't know of any motions or notices of motion. Is there any other business? That being the case, and I don't believe there's any correspondence, so the next meeting of this group is scheduled for Tuesday, the 10th of September at 1 o'clock. I will entertain a motion to adjourn. Warden Smith and Jackie, all those in favor? Enjoy the rest of your summer, and thank you very much for a really good discussion.
Everyone.